Tetanus, as a medical condition, has been known since antiquity, but its exact cause was not understood until much later. Historical descriptions of tetanus can be traced back to the 5th century BC in the writings of Hippocrates, who provided detailed observations of the disease. However, the bacterium causing tetanus, Clostridium tetani, was first identified in 1884 by Arthur Nicolaier, a German physician. Nicolaier successfully isolated the bacterium from garden soil, showing its environmental origins. Further advancements in understanding tetanus occurred in the early 20th century. In 1924, Gaston Ramon, a French veterinarian, developed a method to inactivate tetanus toxin with formaldehyde, leading to the creation of tetanus toxoid, which is used in vaccines. This marked a significant milestone in preventing the disease rather than just understanding or treating it. The development and widespread use of the tetanus vaccine have drastically reduced the incidence and mortality of tetanus worldwide. Tetanus, as a medical condition, has been known since antiquity, but its exact cause was not understood until much later. Historical descriptions of tetanus can be traced back to the 5th century BC in the writings of Hippocrates, who provided detailed observations of the disease. However, the bacterium causing tetanus, Clostridium tetani, was first identified in 1884 by Arthur Nicolaier, a German physician. Nicolaier successfully isolated the bacterium from garden soil, showing its environmental origins. Further advancements in understanding tetanus occurred in the early 20th century. In 1924, Gaston Ramon, a French veterinarian, developed a method to inactivate tetanus toxin with formaldehyde, leading to the creation of tetanus toxoid, which is used in vaccines. This marked a significant milestone in preventing the disease rather than just understanding or treating it. The development and widespread use of the tetanus vaccine have drastically reduced the incidence and mortality of tetanus worldwide. Tetanus, caused by the bacterium Clostridium tetani, follows a specific path from exposure to symptom onset. The spores of C. tetani are commonly found in soil, dust, and animal feces. They enter the human body through wounds, especially deep puncture wounds, lacerations, or burns that provide an anaerobic, oxygen-free environment conducive to spore germination. Once inside the body, if the conditions are anaerobic, the spores germinate into their active bacterial form. These bacteria then produce two types of toxins, tetanospasmin and tetanolysin. Tetanospasmin is the primary toxin responsible for the clinical symptoms of tetanus. Tetanospasmin is a neurotoxin that travels along nerve axons and through the bloodstream to the central nervous system. It preferentially binds to nerve endings at the neuromuscular junction, spinal cord, and brain. The toxin blocks the release of neurotransmitters, particularly those that inhibit muscle contractions, like glycine and gamma-aminobutyric acid. This blockage leads to uncontrolled muscle contractions and spasms. The first symptoms usually appear within 7 to 21 days after infection, but this can vary widely. Symptoms typically begin with stiffness in the jaw, lockjaw, and neck muscles, followed by stiffness and spasms in other muscles. Severe cases can lead to generalized muscle spasms, which can be powerful enough to cause bone fractures. If untreated, the spasms can spread to muscles used for breathing, leading to respiratory failure. Other complications can include hypertension, abnormal heart rhythms, and secondary infections from injuries sustained during spasms. Recovery depends on the severity of the infection, the patient's overall health, and the promptness of treatment. With modern medical care, including wound care, tetanus immunoglobulin, antibiotics, and supportive care, recovery is possible, though full recovery can take weeks to months. Prevention through vaccination is key, as tetanus can be a severe and potentially life-threatening disease. Booster shots for the tetanus vaccine are recommended every 10 years to maintain immunity. Tetanus symptoms can vary in severity, but they typically develop within several days to weeks after the bacteria enter the body. Common symptoms include: the most characteristic symptom of tetanus is muscle stiffness, starting with the jaw, often referred to as lockjaw, and neck muscles. This stiffness can then spread to other parts of the body. Painful muscle contractions, these can be particularly severe and often involve the abdomen. The stiffness of the jaw and neck muscles can make swallowing difficult. Patients may experience spasms in the facial muscles, resulting in an expression often described as a sardonic smile, also known as rhesus sardonicus. Elevated body temperature and sweating may occur. Tachycardia, increased heart rate, is common. Blood pressure can be higher than normal. As the disease progresses, muscle spasms can affect the respiratory muscles, leading to breathing difficulties. This can lead to arching of the back, known as opisthotonos, in severe cases. It's important to seek medical attention immediately if you or someone else is exhibiting symptoms of tetanus, especially if there's a recent history of injury or wound. Early treatment can significantly improve the outcome. Vaccination remains the most effective way to prevent tetanus. Treatment of tetanus focuses on managing symptoms, neutralizing the toxin, and preventing the spread of infection. Here's an overview of the common treatment approaches. Proper care of the wound is essential. This includes cleaning and removing any dead tissue, foreign objects, or sources of infection. This is administered to neutralize the tetanus toxin. Tetanus immunoglobulin provides immediate, short-term protection and can help reduce the severity of the disease. These are used to kill the bacteria and stop them from producing more toxin. Metronidazole is commonly used, but penicillin can also be effective. These medications help control muscle spasms and reduce the severity of symptoms. Diazepam, Valium, is often used for its muscle relaxant and sedative effects. This includes maintaining adequate nutrition and hydration. In severe cases, mechanical ventilation may be required if breathing is compromised due to muscle spasms. Even if a person has had tetanus, they are not immune to it in the future. Therefore, it's recommended to get a tetanus vaccine after recovery, as it provides long-term protection against the disease. Managing complications such as fractures from severe spasms, respiratory distress, or infections is crucial. Severe cases of tetanus often require hospitalization, where the patient can be closely monitored and supported. Prevention through vaccination remains the most effective strategy against tetanus. A complete tetanus vaccination schedule includes a series of doses during childhood, with booster shots for adults every 10 years or after a severe wound or burn.